I'm back at the Harley Street Skin Clinic with Dr Aamer Khan, and today I wanted to ask him about the eye area. And you know, as someone, I'm definitely quite wrinkled around my eyes. I am pretty sure I could do the surgery there, but I don't want to. And I know it's a tricky area, so what is it that one can do that is not surgery around your eyes? Is there anything?
Yeah, there's quite a lot. I think surgery is indicated if there is so much excess skin that it's starting to encroach on your vision.
Right.
In other words, if there's a lot of upper lid skin which sits on the lash line and it's starting to encroach.
Right.
I don't think you're there yet.
Well, I'm not quite there yet, but I think I'm on my way.
Well, we can do an assessment later. But
if it gets down there and I can't see, then I might give in and have surgery.
Absolutely. And that's really a functional reconstructive procedure.
Yes.
And I think that's when surgery should really be considered.
Yes,
But
yes. Well, then obviously there is a reason other than vanity.
Yeah, absolutely. But I think, you know, let's talk about what happens with aging around the eyes. Well, the first thing that people will notice in their 30s is that there's a little bit of thinning of the skin. The skin around the eyes is much thinner than the skin of the face, and it's exposed to sunlight and it starts to age early. So we start to get a little bit of thinning, a little bit of lines and wrinkles.
And when you say thinning, do you mean this area or that area?
The area between from here, from the bone up to the lash line, and the upper lid.
I mean, I've actually had crow's feet since my teens, and I think it must be the way I smile. And so I literally at 16, 17, 18, I had crow's feet.
Yeah, and crow's feet are a result of a dynamic change. So when we smile, the muscles contract and you get crow's feet or smile lines. And they can be quite attractive, they can be quite, you know, quite becoming, but as we get older and if they're associated with thinning of skin, they can start to become what we call non-dynamic lines, which are there all the time. Yeah. And because the tension on the skin from the muscles will cause creasing and even loss of some of the dermis in that area where the creasing is occurring. So we start to get creases. And then of course there's loss of volume in the temporal fat pad, which is supporting the lateral brow, and that starts to drop and we get this lateral droop. Right. So what can we do? Right. Botox is probably the first treatment that anybody should consider, because that helps to relax the sides of the eyes and helps to raise the brow to the neutral position. By doing Botox around here, you'll never get the spocking, because we're not affecting the frontalis muscle, it's just the orbicularis muscle. So it'll go back to the neutral position and give you the best possible muscular balance of your brow, lateral brow. The second thing to consider is a little bit of volume to support that droop laterally as we lose the volume here. And of course, the next thing to consider is a bit of volume in the tear trough, because that will start to go. And the final thing is the skin itself. That can be resurfaced.
Oh, resurfaced. And so laser resurfacing? Either
laser or nitrogen plasma with the fibroblast treatment.
Right. You mentioned this in a previous interview we did. So you said it's like an ablation. It's a little bit painful. And what does plasma? So what does that do?
So nitrogen plasma is very hot nitrogen.
Right.
The other place we find it is on the surface of the sun.
Well, that is hot.
That's very hot. So, but it's very controlled as well. With technology, we can apply a tiny dot onto the skin where you'll get vaporization, crusting, and then below that level, you actually get coagulation, and then below that level, you get thermal change. So you're getting 3 different types of thermal impact on the skin. Getting the ablation, which shrinks the surface of the skin. You're getting coagulation, where you get some shrinkage, but you also get stimulation of regeneration and remodeling. And then you get the gentle heat, which helps to settle inflammation, helps with the healing process.
And where do you do it? Do you do it all around the eye?
Yeah, tiny little dots. So just like with laser, we do a fractional sort of pattern where you get dots with normal skin in between, which then donates the cells for the healing process. So it's a regenerative treatment, and you can get some excellent results with the right people. Absolutely.
Can you?
Yeah.
And you know, we've talked about before that as you age, you get less results. So would someone of my age see a result?
Yes, you would. Because we're physically changing the skin. We're not just stimulating.
Right. And how long would that last for? You do it once, just once?
No, you have a course.
Oh.
So again, with age, there's a rule of thumb that I use. You know, over the age of sort of 40, it's one treatment per decade that you have. So if you're in your sort of 40s, you'd have possibly 3 or 4 treatments.
Right.
In your 50s, maybe 4 treatments. In your 60s, you'd be looking at 5 to 6 treatments.
Right.
So
spaced how far apart?
About 6 weeks apart.
Right.
Because that's the
so that's quite an intense thing, as it's an ablative thing. That
you'll have a week's downtime.
You'd have a week between. You'd have a week's downtime.
Yeah. So you get a little bit of redness, a bit of swelling, but it's a non-cutting treatment.
Yeah.
So the risks are much less.
And you think at the end of a course, you would see a visible difference?
I think in 3 treatments would give you a nice visible difference.
Really?
Yeah.
And how painful is it?
Use local anaesthetic.
Right.
Sophie does it in our clinic.
Right.
And she's very good. We're seeing really good results, getting excellent feedback. Pain management is important.
Yes.
So you can have some pain control, a bit of Valium, and some local anaesthesia. All of those help.
Bottle of rosé.
Afterwards. No, but if you're having Valium, then have somebody with you to go home with, because you don't want to be going out with crazy.
Yes. Okay. And any gentler treatments? I mean, I've tried Peleve. I always pronounce it wrong, which is very similar to fracture affirm, isn't it?
Yeah.
And subtle difference, but I quite like that.
Yeah.
Do you think that things like that, if you keep doing, would have an accumulative effect and slow down the whole aging process?
Absolutely. Yeah. So things you do on a regular basis, like the serums you use around the eyes, that's going to have an effect. You've got to be careful with creams.
Yeah.
And heavier products, because you can get a lot of swelling around the eyes because they attract water.
Yes.
So things like that, absolutely. Radio frequency would be good around the eyes.
Well, Peleve is radio frequency.
Absolutely. Yeah. And then of course, if you're thinking about surgery, then you should consider the fibroblast nitrogen plasma as an interim procedure before you actually go on to surgery.
Oh, really?
And it can prevent the need for surgery.
Wow. Right. So if you're thinking of surgery, try that first, because you might
have an assessment. If you don't absolutely need surgery.
Yes. If you're not sure, try that, because then you may not need it.
Yeah.
Wow. So that really must be quite an effective treatment then. I'll have to have a little think about that.
I'll show you some before and afters later.
Okay. So anything else of the more gentle variety other than Peleve? Is there anything? What about the red light and the Soluma? Does that do anything? But that's not targeted for the eye.
Not targeted for the eye. Your eyes are protected. But you could do things like PRP, which is platelet-rich plasma. It's your own growth factors from your blood, which are concentrated and injected into the skin around the eyes.
Oh, can you inject in the skin around the eyes?
Yeah, and that will help stimulate the collagen and the regenerative process.
Right.
You can, I'd be careful with fillers above the ridge, because you can get what we call edema. They attract fluid. If you've already got thinning of the skin, it'll balloon out and puff up.
Yes, and just the thought of doing a filler around there anyway doesn't sound good. Right. Okay. So they other than the Peleve, they're quite full-on options.
Yeah.
But then I suppose you reach a point where you either have to just be happy with what it is, or you have to try something a bit more full on.
And these are the most important areas for beauty. This triangle of the face, what you change there and how you age here has the most impact on how people perceive you and look at you.
Yeah, yeah. Wow, okay, well, thank you.
You're welcome.